Welcome to HealthCast. I'm your host, Adam Patterson. We are joined today by Dr. Rafael Fricks, VA's Associate Director for AI Medical Imaging, on how Veterans Affairs is leading groundbreaking research applying artificial intelligence towards brain and mental health. The agency has made considerable strides in treating conditions like TBI, as well as PTSD and complex trauma, with VA starting to apply its AI expertise towards better understanding these conditions as well. The agency will be convening its first ever Brain Summit from September 7th through 9th of this year, convening a host of experts within VA and from partner organizations to showcase the future of brain and mental health care. Dr. Fricks, welcome back to the program.
Yes, it's nice to be back here again. Thank you for having me.
Absolutely, and it is always great to have you. And again, just to start off with kind of the preliminaries here, can you tell us a bit about your career and your research interests and what brought you to your current role at NAIA?
Sure, I kind of had a sort of a complicated route, I feel like, into the VA, but I joined the VA as a postdoctoral fellow as part of their Big Data Science Training Enhancement Program, the BD STEP program. Which was a wonderful program. I really encourage a lot of people to look into it if that's in line with your interests. And that gave me an opportunity to work with the Department of Veterans Affairs on various different, especially cancer-centric topics, but also with the radiology department at Duke University. And so my background is that I was doing AI research into radiology applications. And from there, I gradually got to know about the National AI Institute. I was hired in to run their AI tech sprint program, which is continuing to do well these days. And, sort of just started expanding my role. I'm actually now an associate director for AI and medical imaging with the National AI Institute and with the Maverick Center in Boston. And we have a lot of exciting imaging projects that we're looking to do in the future that the VA is really poised to do this work, to sort of, I would even argue, lead the way in some of this work, as we've done with a lot of other radiology innovations in the past, based on the vast amounts of data, resources, and really I sort of think of it as the strength of our mission that we treat so many patients. We are always looking to apply the latest technology in veterans care, and really it's a hotbed for innovation in that way.
Yeah, definitely. It sounds like, again, between your expertise, your partnerships, and the sheer amount of data and resources you have, NIAID is really well positioned to be driving forward medical research, not just for VA, but America as a whole. And you mentioned, of course, that your background included, imaging and research into cancer and oncology. And I'm curious, what areas, broadly speaking, what areas of healthcare and applied to AI have been some of NIAID's main projects since your founding back in 2019?
So through the AI tech sprint, we've definitely screened a bunch of prototypes that have now gone on to be pilot projects within the VA. Those include innovations for suicide prevention, for early triage, for sort of flagging messages that are sent to our Veterans Crisis Line for potential troubling sort of messages that might indicate some sort of distress. But also, we're looking at triage systems for early detection of skin cancer lesions, like different dermatological lesions you might run into. We want to expand that into sort of having an additional triage system for medical imaging, that we have multiple findings that might be visible within routine scans that we'd like to recapture in the future. And in addition to that, we also advise on policy. We've had some involvement with sort of a report from the NIDARD Intra-Agency Committee. NIDARD has set up a fast-track action committee this year to advise the executive branch on privacy-preserving data sharing technology. That this is, now as we start to collect so much data, and we've seen some bad actors out there in terms of what kind of data they collect and how they share it. We're working with various government agencies to evaluate how can you use this data responsibly or develop AI in a trustworthy manner, which is something that we define in our AI strategy. And, how can we continue to keep the public's trust as we develop solutions that are effective and understood by all to, be a public good.
Yeah, absolutely. That's a pretty impressive breadth of research. Again, you said both from your early screening focus to this work on ethical AI and privacy and data protection. That encompasses a pretty interesting scope of work. And it sounds like also, NII is moving more and more into focusing on, I guess you would things you would refer to broadly as cognitive health, mental health and things like that. And from my, again, totally journeyman understanding, and neuroscience and neurology are deeply complicated topics. The human brain, again, is such a fundamentally complicated organ unto itself. And I'm wondering, how is the kind of computational sophistication allowed by AI capacities, the artificial intelligence you have, how is that in particular helpful for advancing our understanding of fields as complicated as brain and mental health?
Well, our big initiative right now is that we are planning on behalf of the VA the Brain Summit, which is intended to be essentially a small academic conference or technical conference thrown by the VA. That this will be a 3-day meeting in September in the Washington D.C. area from September 7th through 9th. And the intention is that we will explore how artificial intelligence is applied in various different domains that we sort of call total brain health. And so those include sort of brain cancers, or more broadly, head and neck cancers. We also have a focus on brain injury and rehabilitation that, the Department of Veterans Affairs treats the most TBIs of any healthcare system in the United States. And so there have been new efforts to apply AI in the domain of traumatic brain injury to try to better understand how that's affecting the individual and see if we can customize their, I should say, personalize really their treatment route. We call that phenotyping of TBI, where if we integrate various different signals, various different types of imaging and medical tests that we can perform, is there some way that we can piece that information together to uh, sort of improve that person's outcomes? And lastly, I would also say that the third sort of core focus area of this summit is in mental health. That in addition to the physical, sort of organic parts of the brain, we want to make sure that we're covering all the bases here. And mental health is certainly a focus of the Department of Veterans Affairs. We have really put out a lot of efforts into suicide prevention recently. That suicide still remains a pervasive problem within the veteran population. And so we want to highlight not only what research is being done in these three domains, but also look at some cross-cutting topics about artificial intelligence, some of these trustworthy and ethical questions that we discussed before, how data can be shared privately, but also federal resources for doing this kind of research that include cloud computing options that are coming online that give us the computational power to really do this research in earnest. And we're also inviting a lot of other government agencies, academia, and industry to discuss these solutions. And a big component of that is the regulatory process. That right now you see a lot of sort of algorithms that are tried in the wild or maybe on a limited data set. And there's a whole process of certifying when an algorithm is appropriate for clinical use that is still in development. Like this is certainly, we have a lot of historical precedent to build on from how medical devices were regulated, but we are adapting those regulations. It's still sort of a emerging area of how do you regulate an AI algorithm? Do you freeze it at a certain parameterization? Do you allow the algorithm to continue to learn? And what happens to the performance as it's applied in the field?
Yeah, absolutely. That sounds like an incredibly promising nexus of research. And the Brain Summit is, again, it sounds like it's the first of its kind and is really bringing together this focus on brain and mental health. And, it is clear that mental and brain health is a huge focus among both VA caregivers and researchers like yourself. You'd mentioned VA treating an exceptional amount of TBI patients, the focus on PTSD and suicide prevention. As just a general scope, are there certain mental and cognitive health conditions that are typically more common among veterans and the general population?
I can't speak particularly to some of the demographics. I do know some unfortunate statistics, like, for instance, TBI is the signature injury of the most recent wars. Part of the reason for that being is that, from my very limited understanding of this subject, is that our defensive countermeasures like body armor, armored vehicles, that sort of thing, have become so much better than in previous wars that uh, casualties on the battlefield that normally would have been fatal are now survivable, but survival now includes perhaps, you know, a possibility of brain injury. That some of these people wouldn't have survived before. Now we're able to bring them back, but there is perhaps some damage. Now, another unfortunate sort of propensity is that mental health issues, I think, are still prominent in the veteran population for a variety of different reasons. I'm not really an expert in this domain, but I know that suicide rates among veterans are still higher than the general population. And that's an aim of like different projects, such as some of the projects we look to highlight in our Brain Summit are, for instance, the outcomes of Mission Daybreak, which was previously the Suicide Prevention Grand Challenge. That has been sort of an industry-wide competition to sort of sprint ahead in some developments in suicide prevention. There's also a number of our pilots, like including the Veterans Crisis Line Triage System that will apply natural language processing to detect for signs of distress in messages that are submitted to the VA. And we have the new 988 crisis line that has been recently unveiled by the Office of Mental Health. So we are bringing a lot of cross-cutting subjects, I believe, because there is, an association between TBI and some of these mental health issues that might arise, for instance, because of the damage. So that's why we really want to bring these practitioners together in the same sort of setting, because there are some cross-cutting needs that can be addressed in this kind of situation.
Yeah, absolutely. And I think that's really critical, that focus on TBI. And it's a really, really, solid point you brought up about the changes in, for example, battlefield injuries from the past conflict and how that is, leading to a particular kind of commonality of injury with TBI and other kind of cognitive relevant symptoms. And, it is really clear that the Brain Summit aligns with VA's broader goals around mental health care and improving mental health and brain outcomes. Can you tell a bit more about how NAII is partnering with other parts of VA to really drive this kind of research forward?
Yes, absolutely. NIE doesn't, our office doesn't really treat patients directly. We're not clinically practicing. And so we often partner with the appropriate department for the clinical expertise and also for the implementation of these different technologies. We're really housed under the Office of Research and Development and the Secretary Center for Strategic Partnerships. So we do a lot more of setting up research pilots, of advising on AI aspects of different research projects, and on a screening of new technologies, like including through the AI Tech Sprint program, where we actively evaluate prototypes. So, like for instance, when it comes to mental health, I'm certainly not a clinician or expert by any means, and so we partner with the Office of Mental Health to really provide that sort of expertise. And that's actually a topic too that has been brought up many times before, is that we want to ensure that technically minded people in artificial intelligence, or sort of developers who are pushing the limits of what we can do with AI, and clinicians who are advancing in their own fields have some overlap or have some collaboration. That's what we really want to get out of this Brain Summit as well.
Definitely. It really does sound like those kind of partnerships between researchers and clinicians is essential for, again, providing information, feedback, for sharing learnings, for that kind of essential collaboration. And on a technical level, I'm wondering, where are you drawing the research, the medical information, the kind of patient data that is being used in NIA's ongoing brain and mental health research? How are those partnerships really being formed to kind of bring that kind of critical information into your process?
Sure, and I again got to give credit to a lot of the offices that we collaborate with. That we will oftentimes collaborate with other offices on a particular research protocol or on a ongoing operational effort. And so, like for instance, really to highlight TBI again, the passage of the Commander John Scott Hannon Act recently has brought with it now a new directive and a new wave of funding to address TBI and mental health research. So we partner then with the sort of lead researchers at the VA, Dr. Stu Hoffman in TBI, who works with various people at the top of their fields across different academic institutes to move in the direction of where the field should be going. So to make that more clear in this context is that the approach that they're looking at tends to be more multi-omic. So you have, for instance, lab values that can be collected through blood tests or blood draws or something to that extent, but you also have genomic testing that patients can volunteer for, that the VA enrolls patients in certain clinical trials. And then you also have very complicated sorts of combinations of structural and functional imaging. There's a new technology, well, relatively new technology called diffuse tensor imaging, which oftentimes I think makes the covers of various textbooks because it looks so fascinating. But the idea behind that technology is that you're able, with an MRI machine, to get a rough sense of connectivity within the brain. So if you combine all this information together, the sort of research questions that we're looking to work with these other investigators to answer are, can you put together an algorithm that can integrate all this information and make meaningful distinctions within our patient population about, what sort of treatment route is really the most effective for a person's particular injuries or particular sort of expression of the illness. TBI is really an enormous category. Depending on the mechanism of the injury, where the injury is, it can have completely different presentations.
Yeah, absolutely. This sounds like just very cutting edge stuff, and both the obvious complexity of the work you're looking into. Again, you mentioned the sheer variability of TBI. It sounds like TBI is more of an umbrella category, than anything else, sort of anything, traumatic that happens to the structure of the brain, as well as, a lot of the work that you're looking into that really seems to be driving kind of like the approach to cognitive science and brain injury treatment forward more broadly. And I'm wondering, in light of that, kind of before we wrap things up, is there anything you'd like to share, both about the upcoming Brain Summit that's going to be next month, aka, September 2022, or just broadly speaking, where you see VA's brain and mental health research going forward from here?
I would defer to the Brain Summit, actually, in this case, because we certainly will have a lot of the top professionals in these fields, a lot of very senior VA members talking about their own initiatives at this event. And so for anybody interested in the Brain Summit, it's September 7th through 9th. It is an open event, so registration is required, but there's no fee associated with it. It will be held at the Hilton in Crystal City, Virginia. That's the hotel that's attached to the Reagan National Airport. And there's information and registration on our website. And on our website, you can also see on the registration page the schedule. The speakers are being updated there. Some of our headliners include not only 9 people, but also Dr. Matt Miller, for instance, who is the director of the suicide prevention program at VA. We have lead researchers from institutes such as Harvard, Johns Hopkins University, really just academics from across the board, Duke University as well, University of San Diego, UC San Diego, I should say. And we hope to have also a strong industry presence in addition to sort of our headline speakers. So I would encourage everybody to get the most complete picture of this summit, which should cover, in addition to these 3 core medical topics, some cross-cutting topics on technology, I forgot to mention also blockchain in healthcare applications, but different infrastructure developments that are happening at VA, regulation and policy, and different innovations, just broadly speaking, will be presented by people at the apex of their field. And for more information, please go to the NAI website at research.va.gov/NAII. And we have a subpage just for the Brain Summit that lists all the topics and can lead you to registration where you can see the speakers and the schedule.
Definitely. I'm sure we're all really looking forward to that. It sounds like an incredibly promising summit. Of course, I'm going to be there, and I'm sure our organization is going to be there as well to cover it and see the work you're bringing together. So again, really looking forward to that. And also, Dr. Fricks, just want to say thank you so much for coming back onto the program.
Yes, thank you again for having us. And I will be happy to share our future directions going forward.
HealthCast, along with GovCast and CyberCast, is a production of GovCIO Media and Research. For more podcasts and to check out the other shows, head to govciomedia.com. Watch out for new episodes released every Tuesday and Wednesday across our shows. You can follow all of them in your favorite podcast platform, and if you like what you heard, make sure to let us know by leaving a review. And if you have any topics you think we should look into, contact us at newsletter@gcio.com.